coordination for you that are very useful for your patients using a technique called repeated contractions. Okay. And I'll tell you what they're useful for. So we're going to practice those because they're very, very useful. And then we need to show you the lower extremity patterns, which are much easier for the therapist, harder for the patient. Okay. And by that time, we will have run out of time. Okay. But these two techniques, two actually activities. One is bridging. Bridging happens to be one of my most favorite exercises. And for PNF, it's using repeated contractions is very helpful for people who have trouble bridging on one side, okay? Bridging is a super useful technique for moving around in bed. You think about it when you need to move side to side in bed, okay? It's useful to initiate rolling, so it's very useful. And also bridging, when you think about it, okay, it combines hip extension with knee flexion, okay? So it really keys in on the glutes. And a lot of times our patients have a very hard time accessing the glutes, okay? So I need one person up here in a bridge position. Okay, you're gonna lie on your back. Okay, come onto your back. Okay, you guys need to move up here.
It's gonna come on your practical exam, guys.
You gotta move. Okay, come closer. Okay. So let's say that she had a total hip replacement, okay, and her glutes are weak. She had total hip replacement on the right, and the glutes are weak on, the right. Her glutes are weak on the right. So when I ask her to do a bridge, when she bridges up, the right side kind of hangs back like that, okay? And let it come down. So it could be she had total hip replacement, could be she had a stroke, okay? If she had a stroke, I may need to stabilize her foot. But for now, we're not gonna worry about the diagnosis. She has some weakness on the right side in the hip extensors, okay? Now we know that stretch facilitates movement, okay? So what I'm gonna do is I'm gonna have her do a bridge, not full, and then I'm going to actually create a maintained isotonic on the strong side. I'm going to try and push her out of the bridge position, and that maintained isotonic, I'm hoping, will create an overflow to the right side, okay? But at the same time, I'm gonna stretch the right side to have the second facilitation of movement, a stretch creating more movement, okay? So you're gonna do that same bridge up with a little, okay?
Mm-hmm.
So come on up and stay there. And I'm gonna hold here, maintained isotonic, then I'm gonna stretch the right side, bring the right side up, bring the right side up, bring it up, bring it up, bring it up, and then come down. I put my hands on the around the posterior hip to come down. So that's called repeated stretch. Very, very useful technique for ortho neuro patients, okay? So let's do it again, same thing. Okay, she comes up and I stop her before the end, hold it there, and now bring that right side up, bring it up, bring it up, bring it up, and then come down. Okay, so I'm doing a maintained isotonic on the right, on the strong side, and I'm creating a stretch on the affected side, on the weaker side. Yes?
When you bring your hands to the bottom, when you tell her to bring it down, are you trying to resist her while she's bringing
No,
it down?
no, because down is just, it's just to give her an idea of where I want her to go. I'm not creating any resistance going down, because that's not glutes, that will be abdominals. Okay? So that's the technique with maintained isotonic on one side, and then so the repeated stretch is the stretch while she's contracting. Okay, but when you put it together, it's very powerful to facilitate you felt yourself, you had to come up, right? You had to come up. So, so that's one application of repeated stretch, which I find very, very useful. The other application is to enhance breathing. And you don't see this that often, but people who've had hemiplegia also, they don't get good expansion on that side. People who have had any kind of lung surgery, either lung replacements or tumor removals or anything like that, any kind of thoracotomy, even breast surgery, they might not be aerating the lung that much. So the technique is exactly the same, but we're going to move it into breathing. Okay. So so let's say we'll still use the right side. Okay. So I'm gonna have her take a breath, and when she takes a breath, I feel like the right side is not inflating as much. Okay. So I'm gonna have her take a breath halfway. I'm gonna hold the unaffected side. So that's that maintained isotonic, not letting it inhale anymore. And then I'm gonna stretch the rib cage down and in, okay? Which is the opposite of up and out, okay? Because we want the ribs to move up and out. So I'm gonna stretch it down and in. So just exhale. Okay, now take a breath in, hold it there. Now, move the right side, get more air to the right side, more air to the right, more air to the right, and then release it. Okay, and take a breath in, hold it there, more air to the right, more air to the right, more air to the right, and then breathe out. Okay, that's all it is. We don't have to worry about manual contacts and hand placements, etc. It's very, very powerful. Okay, so that I want you. Are you confused?
A little bit. So that she breathes in, and then
I stop the expansion on this side. So I have her take. I first have her take a deep breath, and I see how much she's expanding, and then exhale. And then take a deep breath and stop, hold it there. And so when she goes about halfway, then I start to stretch the other side. And it's with each stretch, the verbal cues are really important. And breathe in on the right, breathe in on the right, breathe in on the right. And she'll get more air on the right because of the stretch and the manual contact and the irradiation from the left side.
Guys, remember the radiation principle? When we were doing the neck is going to, it's the same principle. Dr. Sopra has used the strong side, we resist it with maintained isotonic, and then the quick stretch, what Dr. Sopra is trying to guide the patient. Every time she says, and breathe, she's giving a prep command and she's giving a stretch and have the patient breathe it and breathe. It is stimulating. What happens when we give a stretch? We are facilitating it. So we want that part of the lung to expand further, the muscles to move so that you have better breathing. So that's, I use it all the time.
Yeah, it's repeated stretch, yeah.
So, for the glute one, for the bridging one, I thought that it was stretch, 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 and push up, but every time you're doing the stretch,
Push up, yeah.
you're pushing up and
Yeah.
reacting to that stretch.
It's not 3 stretches, 1 push. It's stretch, bring it up, bring it up, bring it up.
So think of it as a prep command that you're giving, and then you're stretching, and that means you're facilitating. You're stretching in the opposite direction, so you're facilitating the motion to happen, what you want it to happen, and you're doing it on multiple levels such that we have the best contraction by the end.
And timing
Yeah.
is everything because the words take longer to process than the stretch. So I say and bring, and when I do and bring, I stretch it up so it happens simultaneously. Okay, you need to practice that. I think you should practice that because that's useful, very useful.